Okay, so the next step we'll be talking about is evaluation. After completing this chapter, you should be able to describe evaluation, its purpose, its relation to other steps in the nursing process. Evaluate the patient's achievement, 4 types of outcomes specified in the care plan. Manipulate factors that contribute to success or failure in the outcome achievement. Use the patient's response to the care plan to modify the plan as needed. Explain the relationship between the 6 quality assurance, quality improvement programs, and excellence in health. Describe the AACN's 6 essential standards for establishing and sustaining healthy work environments and the 7 crucial conversations in healthcare. Value self-evaluation as a critical element in developing the ability to deliver quality, person-centered nursing care. So in the 5th step of the nursing process, evaluating, the nurse and the patient together measure how well the patient has achieved the outcomes specified in the plan of care. When evaluating patient outcomes achievement, the nurse identifies factors that contribute to the patient's ability to achieve expected outcomes and, when necessary, modifies the plan of care. The purpose of evaluation is to allow the patient's achievement of the expected outcomes to direct future nurse-patient interactions based on the patient's response to the plan of care. The nurse decides to terminate the plan of care when each expected outcome is achieved. Modify the plan of care if there are difficulties achieving the outcomes, or continue the plan of care if more time is needed to achieve the outcomes. Nurses measure patient outcome achievement. How effectively nurses help targeted groups of patients to achieve their specific outcomes. The competence of individual nurses and the degree to which external factors such as different types of healthcare services, specialized equipment or procedures, or socio-economic factors influence health and wellness. The patient, however, is always the nurse's primary concern. The 5 classic elements of evaluation are identifying evaluative criteria and standards. What are you looking for when you evaluate expected patient outcomes? Collect data to determine whether these criteria and standards are met. Interpret and summarize findings. Document your judgment, terminating, continuing, or modifying the plan. Each element requires the nurse to think critically about how best to evaluate the patient's progress towards value health outcomes. Although the terms criteria and standards often are used interchangeably in reference to the evaluation step, they are different. Criteria are measurable qualities, attributes, or characteristics that identify skills, knowledge, or health states. They describe acceptable levels of performance by stating what is expected of the nurse or the patient. Standards are the level of performance accepted by and expected of nursing staff or other healthcare members. They are established by authority, custom, or consent. Nurses write expected outcomes during the planning phase of the nursing process. The type of patient data collected to support the evaluation of the outcome achievement depends on the nature of the outcome. The data collected to determine the degree of outcome achievement are recorded in evaluative statements, in addition to knowing what type of data to collect to determine outcome achievement. The nurse needs to know when to collect the data. The most common mistake nurses make when evaluating in acute care settings is waiting until the day the patient is to be discharged before evaluating the outcome achievement. At that point, it's too late to revise the plan of care. After data have been collected and interpreted to determine patient outcome achievement, the nurse makes and documents a judgment summarizing the findings. This term is the evaluative statement. The 2-part evaluative statement includes a decision about how well the outcome was met, along with patient data or behavior that supports that decision. Outcomes may have been met partially or not met at all or fully met. When the evaluation reveals that the patient has made little or no progress towards outcome achievement, the nurse must re-evaluate each of the preceding steps of the nursing process to try to identify the contributing factors causing the problem with the plan of care. Each nurse must decide how to respond when compromised patient care has been identified. Nurses committed to healthier patients, quality care, reduced costs, and the personal satisfaction of knowing they are actually make a difference versus merely wishing things were different value performance improvement. The prevalent culture of poor communication and collaboration among healthcare professionals is significantly related to continued medical errors and staff turnover. Quality assurance programs that promote excellence in nursing. The American Nursing Association model quality assurance program consists of 7 steps: identifying values, identifying structure, process, and outcome standards and criteria, measuring the degree of the attainment of the criteria and the standards, making interpretations about the strengths and weaknesses based on such measurements, identifying possible courses of action, and choosing a course of action, and then taking that action. Quality improvement consists of systematic and continuous actions that lead to measurable improvements in healthcare services and the health status of targeted patient groups. 4 key principles of quality improvement are focusing on systems and processes, focusing on the patient, focusing on being a part of the team, and focusing on the use of the data. An evaluative program that focuses on patient satisfaction is a powerful tool for patients and family who want to know what care will be like before choosing a healthcare facility. Nursing sensitive quality indicators identify structures of care and cultural processes that influence care outcome. The goals of the National Database of Quality Nurse Indicators are to promote and facilitate the standardization of information submitted by hospitals across the United States on a nursing quality and patient outcomes. The cultivation of evaluation as a critical component of the nursing process helps ensure nursing's continued success in achieving desired changes in patient health status. Nursing actions are far too vulnerable and costly to be haphazardly implemented. Evaluation that is carefully planned and executed can direct and redirect these actions to maximize the patient's benefit. This is the outcome and the challenge of the nursing evaluation. Perhaps the most important question to reflect on is, are your patients and their families better for having had you share in the critical responsibility of partnering with them to evaluate the development and implementation of the care? So, now let's continue on with this PowerPoint. So what exactly is evaluating? When we evaluate someone, they're measuring the extent to which the patient has achieved goals specified in the plan of care. These factors that may positively or negatively influence goal achievement are identified, and the plan of care is terminated or revised. During the evaluating step, the nurse and the patient together can measure how well the patient has achieved the outcomes that were previously specified in the nursing care plan. The nurse helps identify factors that contribute to the patient's ability to achieve those different outcomes. And when necessary, the nurse will modify that care plan. The purpose of the evaluation is to allow the patient's achievement of the expected outcomes to help direct those future nurse and patient interactions. So this is the 5th step of the nursing process. And when necessary, based on the patient's response to the care plan, the nurse is going to either terminate the care plan if the expected outcome is achieved, revise or modify the care plan if there are difficulties achieving the outcome, and then continue the care plan if more time is needed to achieve that outcome. When evaluation points to the need to modify the nursing care plan, the nurse reviews each preceding step of the nursing process. So as nurses, we are evaluating and measuring these patient outcomes. Okay, and we're looking at how different procedures, different socio-economic factors, different nursing degrees, different external factors. We're looking at how all these things influence health and wellness. But our first and primary concern always has to be the patient. Um, we are performing these nursing procedures and we're trying to do it competently, creatively, and with care. But in the end, if it doesn't help the patient reach the desired outcome, then it's not really meaningful to the patient. And overall, that is the main concern. Now, either directly or indirectly, the aim of all nursing evaluation is quality nursing care that helps the patient achieve that desired outcome. However, the most important act of evaluation performed by nurses is evaluating the outcome achievement with the patient. So tell whether the following statement is true or false. The purpose of evaluation is to allow the patient's achievement of expected outcomes to direct future nurse-patient interactions. Is that true or false? Okay, if you said true, you were right. The purpose of the evaluation is to allow the patient's achievement of expected outcomes to direct future nurse patient interactions. Again, care plans may be terminated if the care plan has allowed the patient to reach the expected outcome. They should always be modified when the patient's having difficulty or cannot achieve the outcome. And there's different ways to modify them. So maybe we wanted the patient to ambulate 100 feet um, without experiencing any shortness of breath, but we might be able to reduce that to 50 feet. So we making the outcome more achievable for the patient, or we may have to allow the patient more time to complete the outcome. So if we need more time, then we're going to continue that care plan because maybe the patient is making small steps towards that goal, but they just haven't quite reached it yet. And so now we have to say, well, for this patient, they may need a little more time than someone else I've previously dealt with in the past. Um, Again, we talked about these outcomes before, and it's going to be the same process, just how it relates to the evaluation process. So, cognitive is asking the patient to repeat information or apply new knowledge. So, having them verbally repeat back to you what you've told them about, signs and symptoms or certain exercises that you want them to do or certain diets that we want them to follow. Okay? And then we also talked about psychomotor. Psychomotor is using those skills. So asking a patient to demonstrate a new skill, walking with a cane, applying a dressing, um, even using an incentive spirometer. Okay, it could be as simple as that. And then effective, observing the patient behavior and conversation. So, the patient says, well, I'm not going to stop smoking because that doesn't affect my health. I've been smoking for 20 years and I'm fine. Um, Obviously, if that's their attitude towards stopping or towards smoking cessation, then you may have to have another approach because they have to believe that the behavior they're going to engage in, or they have to have a value attached to the behavior that they're going to engage in, that it's somehow going to benefit them. If there's no value there for them, then they won't engage in that change. Okay, and then how ready and willing are they to accept that change. And then physiologic is using that physical assessment to skill to collect and compare data. So we talked about this I talked about this before with a newborn going home, and I talked about monitoring the baby for weight gain or thereof loss, because we wouldn't want the baby to have a certain loss within the first couple of weeks going home. So another thing that where this might apply is a patient that is in heart failure. So again, we're monitoring weight because we're determining the risk for exacerbation of that heart failure. If they gain too much weight, in a certain amount of period, it's an indicator that the heart is not pumping as well as it was. which is an example of a psychomotor outcome. So, your patient learns how to control his weight using the Choose My Plate food guide. A patient is able to test for glucose levels and inject as needed. A patient values his health enough to decide to quit smoking. A patient is able to ambulate the hallway following knee surgery. So remember, this is actually learning and applying a new skill. A new skill. So if you said B, you would have been correct because the patient learned how to test for the glucose levels and actually inject the insulin as needed. So that was an actual new skill. Okay, psychomotor outcomes involve the patient's achievement of a new skill, such as controlling diabetes. Cognitive involves an increase in patient knowledge. Affective outcomes pertain to changes in patient values, and physiological outcomes target physical changes in the patient, such as ambulating up that hallway after the knee surgery. There are 5 classic elements of evaluation. Okay. The goal: Mr. X will ambulate 25 feet independently after 3 sessions of physical therapy. So, what actually happened? This gentleman was able to ambulate those 10 feet independently. When we identify evaluative criteria and standards, we collect data to determine if the criteria and standards are met. We document your judgment, and then we terminate, continue, or modify the plan. So remember, for identifying evaluative criteria and standards, what are you looking for when you evaluate, and what is your expected outcome? So for this gentleman, we were looking for him to be able to ambulate 25 feet independently. Okay. Um, he was able to ambulate 10 feet independently. Okay, so in this case, we would have to modify this goal. Maybe he's not quite ready to do the 25 feet, so we'll continue to work with him. But he did partially meet the goal because he was able to go at least 10 feet on his own. What kind of variables can affect our patient outcomes or our patient achievement? So, for example, if the patient gives up and refuses treatment, all right, that would be a patient variable. If the nurse, maybe the nurse had a burnout or couldn't handle it, okay, then that would be an issue for her. Or healthcare system, maybe they couldn't help meet the goal because we didn't have enough staff to safely help that patient, or to safely stand there while that patient was ambulating up the hallway to make sure, that they could safely do it independently on their own. So each element requires the nurse to use critical thinking and reasoning about how to evaluate the patient's progress towards the outcome, and then these variables we are going to take into consideration because they could play a part in us being able to meet our goals and outcomes for the patient. So our evaluative statements are going to decide if the outcome was met or not. So met means the goal was totally met. Partially means exactly that. For our patient in the first example, it was partially met because he was able to ambulate 10 feet independently, just not 25 feet. And then the goal could not be met at all. So we would also list patient data or behaviors that support this decision. Like after Mr. So and so able to ambulate 10 feet. However, after 10 feet, individual started to show signs of weakness and had to grab the hand railing, or had to get assistance from the therapist or the nurse. And then we are going to decide whether or not we need to either delete or modify the nursing diagnosis. So if it doesn't look like our patient's making any progress at all, we may have to come up with another sort of intervention there, or goal. I'm sorry. If we felt like the patient's making progress and they might be able to meet the progress, then we could modify the nursing diagnosis and make the outcome statement more realistic for that patient, or maybe adjust the time so that the patient can reach the goal. And if the goal seems too simple, we may have to increase the complexity of it. All right. Also, we might have to change some of our nursing interventions. We're determining now the adequacy, so we need to evaluate how well the desired outcome was. How was our patient achievement? How easily was it achieved? Review how the process is used, revise the care plan if necessary, and then we would want to participate in quality assurance programs. So we do this because sometimes we discover problems with delivery of nursing care in the practice setting. So by using these quality um, assurance or this quality health care, we can help to base care on continuous healing relationships, customize the care on the patient's needs, make sure we maintain the patient as the source of control. We can share knowledge. It can help assist with our evidence-based practice decision making. Um, it helps us understand that safety is a priority. It also gives us the ability and the need for transparency, which means that we're being open and honest with our patient, and also with things about their healthcare so that they can make informed decisions. We are able to anticipate patient needs. We're able to continuously decrease waste of resources and times, and it helps us to get cooperation amongst healthcare facility, other clinicians for better care for the patient. So again, these are all the things I just talked about and how it would help improve care amongst nurses and healthcare facilities for the patient. Those four crucial steps for improving performance are to discover a problem, plan a strategy using indicators, implement that change, and assess the change or plan to develop a new strategy if the outcomes aren't met. And then we would want elements of a healthy work environment, skilled communication, collaboration amongst departments, look at strategies to help make effective decision making, make sure we have appropriate staffing whenever available, make sure that our outcomes have meaningful recognition to our patients, and make sure we have authentic leadership taking us through these steps. In the United States, regulatory facilities such as boards of nursing, Joint Commission, and Professional Standards Review Organization, along with National Health Planning and Resources Development Act of 1975, which requires nurses to document nursing standards, are being implemented and maintained. Each of these facilities is concerned with quality care and quality control. The decreased availability of resources to treat patients in hospitals and the unavailability of sufficient alternative treatment settings pose a strong challenge to the nursing profession to find ways to avoid compromising the quality of care. There are 7 crucial conversations in healthcare. The following are those conversations and examples of them. The broken rules. The colleague fails to wash hands. You should confront your colleague and tell her that you noticed that she failed to wash her hands, and this could be harmful to herself and other patients. If the behavior continues, then you would want to report that to the manager and on up the chain of command as needed. Mistakes. The nurse administers medication to the wrong patient and asks you to keep an eye on the patient for adverse reactions. She does not plan to report the error. Tell your colleague you'd be happy to help watch the patient, that a full report needs to be made. If appropriate, help your colleague identify what contributed to her giving the medication to the wrong patient. Lack of support. The nurse refuses to help a colleague move an obese patient, although she has time to do so. Explain to the nurse that teamwork is essential. To do good outcomes, her behavior is simply unacceptable. When we have patients with special needs and need all hands on deck, everyone free and obligated to help out should do so. Develop and enforce a zero tolerance for selfish behavior. Incompetence. The nurse fails to correctly administer dialysis. She wasn't finished with her orientation to the unit and attempted to do a procedure on her own before she was prepared to do it. In addition to reporting the error, help the nurse identify that overconfidence in their abilities can have deadly results for patients. The nurse manager will need to address the incompetence. A particularly difficult family is splitting the team by choosing and rewarding favorites among the staff and complaining to them about other workers. The staff is encouraging this behavior. Someone needs to call the team together and name the diverse behavior and get everyone working together. If the staff is problematic, appropriate channels need to be used to address these behaviors. Disrespect. When a student nurse asks a physician if she has time to answer a few questions for a patient, the physician screams at her and tells her that she has more important things to do than babysit her patient and tells the student to find someone else to answer the questions. The student should calmly tell the physician that her response is inappropriate and she is entitled to a respectful conversation, then seek the counsel of an experienced nurse. The physician's behavior should be reported. The student micromanagement. A student nurse asks her clinical preceptor, "Will you walk me through this procedure before I do it since it's my first time?" The preceptor then takes over the procedure for the student and starts watching her every move. The student should inform the preceptor that she merely wanted to review the steps of the procedure to make sure she would perform it correctly, and that is essential for the student to gain experience by trying new procedures. If the preceptor's behavior does not change, the student should seek the counsel of her instructor. And that concludes this video.